Have you ever wondered how medicines work in your body once you swallow them? The journey of a drug, from the moment it enters your system until it gets metabolized, is a fascinating process. Central to this journey are two fundamental concepts: absorption and bioavailability. Absorption refers to the process by which the drug gets into the bloodstream, while bioavailability is the proportion of the drug that reaches circulation and is available to have an effect. These terms aren't just scientific jargon, they're crucial pillars of pharmacology. For those in the pharmacy field, understanding these principles can lead to better patient outcomes. It can guide the development of new drugs and help in their effective use. It's the difference between a drug doing its job well and it not working at all. So, let us dive into the depths of these intriguing concepts. First, let's unveil the mystery of drug absorption. Now, imagine a postman delivering a letter. The letter in this case is the drug, and your body is the house it needs to reach. The postman doesn't just toss the letter at the house, right? The letter has to go through a series of steps to get inside. It's the same with drug absorption. When you take a drug, it doesn't magically appear in your bloodstream. Whether it's swallowed, injected, inhaled, or rubbed on your skin, the drug has to travel from the site of administration into your bloodstream. And that, my friends, is what we call absorption. Think of it as a journey, one that the drug embarks on the moment it enters your body. It navigates through various physiological hurdles, like the stomach's acidity if it's swallowed, or the skin's barrier if it's a topical application. After conquering these hurdles, the drug finally reaches the bloodstream, its ultimate destination. But why the bloodstream, you ask? Well, the bloodstream is like the highway of your body. It's the quickest way for the drug to reach all the parts of your body where it's needed. So in layman's terms, absorption is the process of the drug moving from the site of administration into your bloodstream. It's the first step in ensuring the drug can do its job effectively. In essence, absorption is the journey of a drug from the outside to the inside of your body. But wait, this journey isn't as simple as it seems. Just like any epic adventure, the path from ingestion to absorption of a drug is fraught with challenges. There are several factors that can influence this process, making it more of an obstacle course than a straight shot. First, let's consider the form of the drug. Is it a pill, a liquid, or perhaps an injection? Each form has its unique pros and cons. For instance, a pill might be easier to swallow, but it needs to be broken down in the stomach before its active ingredients can be absorbed. On the other hand, a liquid medication might be absorbed more quickly, but it could also be more likely to cause stomach upset. Next, we have to consider the individual who's taking the drug. The patient's age and health status can significantly affect absorption. For example, as we age, our bodies undergo changes that can impact how we process medications. Our metabolism slows down, our body composition changes, and our organ function can decrease. All these factors can affect how quickly and effectively a drug is absorbed. Health status also plays a crucial role. A person with a chronic illness, for instance, might absorb drugs differently than someone who is healthy. And don't forget about genetic factors. Some people are simply wired to absorb certain drugs more efficiently than others. Last but not least, we can't ignore the role of food. The presence or absence of food in the stomach at the time of drug ingestion can significantly impact absorption. Some medicines need to be taken on an empty stomach to be absorbed properly, while others are better absorbed when taken with food. In a nutshell, the journey from drug ingestion to absorption is a complex one, impacted by factors like the drug's form, the patient's age and health status, and the presence of food in the stomach. So, multiple factors can turn this journey into an obstacle race for the drug. Now that we know how drugs enter our body, let's explore what happens next. This is where we delve into the concept of bioavailability. Bioavailability is a fascinating and crucial aspect of pharmacology. It's the proportion of a drug that successfully makes it into the bloodstream and is able to exert its therapeutic effect. Let's break it down further. Imagine you're sending a package to a friend. You pack it, ship it, and it goes through a series of complex processes before it finally reaches your friend. Now, if the package arrives intact on time and in the exact quantity you sent, it has achieved 100% bioavailability. But in the case of drugs, achieving 100% bioavailability isn't always feasible. Why? Because the drug must navigate a maze of physiological barriers such as metabolic enzymes and physiological pH. These factors can alter the drug, reduce its quantity, or even destroy it completely before it reaches its target site. It's also important to note that bioavailability isn't just about the quantity of the drug that reaches the bloodstream. It's also about the rate at which it does so. Some drugs are designed to release slowly over time, while others need to hit the system fast. Bioavailability, in a nutshell, is about how much and how fast a drug reaches its intended destination. But again, the story doesn't end here. Like every complex tale in the world of pharmacology, the concept of bioavailability is influenced by a multitude of factors. Understanding these can provide valuable insights into why certain drugs work better for some people than others. First up, we have the drug's own chemical properties. The solubility of a drug, for instance, plays a crucial role in its absorption and therefore its bioavailability. Water-soluble drugs are typically absorbed more rapidly than their fat-soluble counterparts. Similarly, a drug's stability in the stomach's acidic environment can also impact its absorption. Drugs that are unstable under these conditions may not reach the bloodstream in their active form, thus reducing their bioavailability. Next, we have the body's metabolic rate. The human body is a well-oiled machine, and its various systems work in harmony to metabolize substances, including drugs. However, the speed at which this happens can vary greatly from person to person. A fast metabolic rate might mean that a drug is broken down and excreted more quickly, reducing its bioavailability. On the other hand, a slow metabolic rate could lead to the drug remaining in the body for longer, potentially increasing its bioavailability. Finally, the method of drug administration can also significantly affect bioavailability. For example, drugs administered intravenously bypass the absorption process entirely, leading to a bioavailability of 100%. In contrast, drugs taken orally must survive the journey through the digestive system, where they are subjected to various processes that can reduce their bioavailability. As we delve deeper into this fascinating world of pharmacology, it's clear that the journey of a drug from administration to action is not a straightforward one. It's a complex dance involving the drug's properties, the body's metabolic rate, and the method of administration. And each step in this dance can influence how much of the drug eventually makes it to its intended target. As you can see, bioavailability is a game of speed and efficiency. And like any game, understanding the rules can help us play it better. Phew, that was a lot of information, wasn't it? Let's take a moment to revisit the key points we've discussed today about drug absorption and bioavailability. We started our conversation by exploring the concept of absorption. We learned that absorption is the process by which a drug passes from its site of administration into the bloodstream. It's the first phase of a drug's journey in our bodies, and it's critical because it determines the speed and quantity of a drug that reaches our bloodstream. We then delved into the factors that influence absorption. These included the physical and chemical properties of the drug, the route of administration, and the physiological conditions of the patient. Each of these factors can significantly affect how quickly and efficiently a drug is absorbed. Next, we turned our attention to bioavailability. We came to understand that bioavailability is the proportion of the administered drug that reaches systemic circulation in an unchanged or active form. In other words, it's a measure of how much of the drug actually makes it to the site of action in our bodies. We concluded our discussion by examining the factors that can alter bioavailability. We found that these factors can be divided into two main categories: drug-related factors, such as its formulation, dose, and route of administration, and body-related factors, such as the patient's age, health status, and genetic makeup. In essence, understanding drug absorption and bioavailability is like having a roadmap of a drug's journey in our bodies. It allows us to predict the drug's behavior and helps us make informed decisions about its administration and dosage. Remember, understanding these concepts not only helps us appreciate the science behind medicines, but also guides us in their effective use. Subscribe for more, because you won't find me later.